So morning everyone, thanks for joining us for this final drop-in session for cohort 5 applications to the Digital Health Leadership Programme. Today's session is going to be slightly different to some of the drop-ins that we've previously run, with a particular focus and spotlight today on the executive sponsors associated with the programme. So welcome everyone, my name's Sam Hanson, I'm project manager, part of a recruitment team overseeing the intake for cohort 5 of the Digital Health Leadership Programme. I've also got my colleague Rachel Dunscombe from Imperial College. So Rachel, if I just hand over to you to introduce yourself, if that's okay.
Yeah, absolutely. So I'm CEO for the programmes at Imperial in Edinburgh with HDR UK, and I'm also visiting professor at Imperial, so providing part of the wider academy programmes, in this case the Digital Health Leadership Programme.
Brilliant, thank you Rachel. So if we could just go on to the next slide please, just to run through a bit of housekeeping quickly and just how today's session is going to run. So for those of you who've joined us today, just a quick ask please, just to remain on mute if that's okay. Very welcome to have your cameras on and say hi. We will be having a chance at the end later in the session for asking any questions that you've got, either to bring to today's session about executive sponsors, or likewise if there's anything that pops up from today's overview, then do pop your questions into the chat or raise your hand and we'll pick those up towards the end of the session. Just to remind people that this session is being recorded today. We haven't recorded previous drop-in sessions. We have recorded a number of panel sessions that have taken place in recent weeks, focusing on hearing from alumni and participants who've been through the programme, and they will be being made available on the Digital Academy's website. But again, just to remind people, this session today will be being recorded, given that we'll be giving a particular focus on executive sponsors. So for anyone who's not able to join us today, a recording of this will be circulated and put on the Digital Academy's website in the next couple of days. So just to run through how today's going to work, so we've got about 50-55 minutes for this session remaining. I'm just going to spend no more than really 5-10 minutes maximum just talking at a really high level about some of the key information to do with cohort 5, both from the application side of things as well as just a quick overview of some of what the programme covers. And then the real focus of today is going to be talking and discussing about the executive sponsors associated with the programme. So my colleague Rachel is vastly experienced in having been an executive sponsor herself in previous years for participants. Really going to just focus on hearing more around what the executive sponsor role entails. If there's information around identifying perhaps suitable executive sponsors and any questions that go with that really. So without further ado, we'll kick things off. So if I could just go on to the next slide, please. So just to give a bit of an overview of the Digital Health Leadership Programme. Obviously, if you've joined us today or listened back to this recording, then you're probably going to be interested in applying and already aware of what the programme is. But just to recap, so the programme is a 12-month fully accredited postgraduate diploma, and that's delivered by our lead partners at Imperial College London, along with their partners at the University of Edinburgh and HDR UK. So we're into our 5th year, our 5th intake of the programme. So cohort 4 kicked off in September of 2021, and there were 3 cohorts that were taken in before that. So we are now in the process of recruiting for cohort 5. The programme itself this year for cohort 5 will kick off and begin in September later this year. I'm sure that will come around fairly quickly at this rate, and we'll be looking to take in approximately 100 individuals, which is similar to the numbers of the previous cohorts that have gone through the programme so far. So if I could just move on to the next slide, please. So just to summarise a bit of information, and this is all outlined on the Digital Academy's website if you want to go back and have a look at more information as well in your own time. But the programme really targets our digital change leaders. So we've heard feedback from previous years that it would be helpful to have more guidance and some information around perhaps who the programme is suitable for, to help individuals make a choice about whether it's right for them or not. So we've outlined some eligibility criteria here for cohort 5, and this is all listed on our website as well to go and have a look at. But just to recap what our criteria is this year. So first and foremost, looking for individuals who are either directly employed by an NHS organisation as a member of the workforce within England, or alternatively, if you work for a non-profit organisation commissioned to provide a minimum of 18 months services into the NHS starting from September 2022. Likewise as well, looking for individuals who really have experience in roles that involve implementing and driving digital transformation change. So although the guidance on our website says typically minimum 3 years, this is by no means prescriptive. Really looking to understand and hear from individuals who've got experience and what their journey and their narrative and examples that have been involved with working in digital transformation change, either within their local organisations or across the wider system as well. Individuals from both clinical and or non-clinical backgrounds are very welcome to apply to the programme. And just a final criterion there as well. So individuals who are already enrolled on a higher education programme, whether it's a master's or a PhD, an MBA or similar equivalent programmes, if you are enrolled in that and that programme is due to continue past September of 2022, but unfortunately you won't be able to apply this year for cohort 5, as unfortunately that's just an academic requirement whereby Imperial College London aren't able to admit participants who are dual enrolled in a higher education programme. So if I could just go on to the next slide, please. So this really just summarises what the application process for cohort 5 looks like. And again, please do go to the Digital Academy's website if you want to read about more information and the details of applying. But if you are thinking of applying, do go to our website first, and there's a lot more information there around helping prospective applicants understand more details about the programme, and likewise there's a lot more information in there about the individual modules and the learning outcomes and some of the assessment methods used as part of the programme. You'll also need to identify an executive sponsor, which is going to be the focus of the remainder of this session shortly, that we'll talk in more detail around finding an executive sponsor, as you will be required to identify one to support you with your application, and likewise anyone who does receive an offer for cohort 5 will require an executive sponsor to support them throughout their time on the programme. Anyone who is planning to apply, then the window to apply for cohort 5 is open at the moment. You've got 1 week from the day of what we're recording this session today. So at the moment, the applications for cohort 5 will close at 11:59 on the 24th of March. So just over a week now to apply. So if you are thinking of applying, you can do that on the Digital Academy website. There's a link to the application portal where there is a application form to complete. The application is really focused on 4 key assessed questions, looking to identify individuals' experiences and journey in digital to date, and likewise as well, how they think the programme can benefit both themselves and their organisation and the wider system, and likewise what they can bring to the programme themselves as well. A step that we've also introduced for cohort 5 this year is that in advance of the cohort 5 application window closing, anyone who puts in an application this year will need their executive sponsor to complete an executive sponsor survey. It's really quick and easy. It should take your executive sponsor no more than 5 minutes to complete, and a link to do that is on the Digital Academy's website. And it really just asks the executive sponsor to confirm that they have had the conversation and are happy to support the applicant's application to apply for cohort 5. Likewise, also that they have been cited and have seen the supporting statements of the individuals that they're supporting, and also that they really commit and agree to the roles and responsibilities of being an executive sponsor, and we'll come on to talk more about that in detail for the rest of this session. So once the application window closes on the 24th of March, we'll then be into assessing the applications that have been received. So that will take place throughout the majority of April 2022. And then once that's completed, we'll then be aiming really from early to mid-May of 2022 to be communicating the outcomes to anyone who's applied, whether they've been successful and received a place for cohort 5, at which point they'll then be contacted by our colleagues at Imperial College London to begin the academic enrolment process ahead of starting in September, or whether you've been placed on a reserve list for cohort 5, or whether you've been unfortunately unsuccessful in applying for cohort 5 this year. So if I could just go on to the next slide, please. Just to summarise really what the programme covers. So there are 6 main modules that consist of the programme, and do check out the Digital Academies website, where there's a real in-depth description of each individual module and the learning outcomes associated. But we've got modules ranging from the essentials of healthcare systems, strategy and transformation, healthcare information systems, module 4, which focuses on user-centered design and citizen-driven informatics, module 5, which is decision support knowledge management and actionable analytics. So those modules run in sequential order throughout the 12 months of the programme. And then the 6th module, which really looks at the principles and also the foundations and applying leadership, will run throughout the duration of the 12 months on the programme as well. And there's a real range of assessment methods that are used to assess individual modules. There are no exams associated with any of the programme, any modules associated. So there's a range of assessment methods used, from reflective logs through to academic essays, poster submissions, as well as board pitches, and also a number of activities on the leadership forums and the residentials that individuals come together with on the programme as well. So if I could just go on to the next slide, please. Just to summarise here as well, some additional information about the support available to candidates who are on the programme. So Imperial College London really provide a really comprehensive range of support available, through to pastoral support, working with individuals on a one-to-one basis where needed. Likewise as well, obviously the executive sponsor support mechanism that is available we'll come on to talk to later on in this session. Likewise as well, the support mechanisms available through the programme, from individual peer support groups of bringing small groups of individuals together as well. Throughout the programme, we've heard some really strong feedback recurring from everybody who's been through the programme, that the peer support mechanisms available through the programme is really well received. It helps individuals to build their networks and their contacts, and to meet individuals from across the system that they perhaps wouldn't have done if they weren't on this programme. Likewise as well, Imperial College has the Disability Advisory Service as well, available to participants throughout their time on the programme. So anyone with additional learning requirements, there is a real strong range of resources, support and tools available to support individuals throughout their time on the programme as well. So if I could just go on to the next slide here, I think this is just a summary slide here, just to recap. So if anyone does want any further information, the first place we would recommend is just to go to the Digital Academies website. There's a lot more information around what I've talked about for applying for cohort 5, as well as details on what the programme covers. We do have a mailbox as well, so anyone who's here today or is listening back to this and has any questions on anything that's been covered, or just sort of any other thoughts in advance of cohort 5 applications closing, do get in touch with our mailbox and we'll pick that up with you on a one-to-one basis, however best we can help. Likewise, if anyone's active on social media and on Twitter, do follow the @HEDigiReady account, and likewise there's an equivalent for the Digital Health Leadership Programme's Twitter handle that will pop in the chat as well, to be able to follow any recent updates and news and announcements about cohort 5 and the Digital Health Leadership Programme. So that was all that I wanted to cover, just to summarise some key info for the programme. So at this point really we're going to kick off what is the focus of this session now with my colleague Rachel, just to talk and explore in more detail whether we have executive sponsors who have joined us today on the call, or likewise whether we have any executive sponsors who are listening back to this recording as well. Really just to explore in more detail now really around what an executive sponsor is, some of the details around what could be expected of an executive sponsor, and likewise as well any information around perhaps identifying an executive sponsor. But at this point I'm going to hand over to Rachel, and really I'll let you kick off from this point about executive sponsors, if that's okay.
Thanks, Sam. And that's a fantastic background to the programme. So just to say, as well as actually leading this programme, I have been a sponsor for 3 individuals while I was still a CIO. So in essence, I've been through the sort of sponsorship loop. Now, first of all, you may think, why do we want to put people through this programme? because they will be very, busy in the workplace. And what I have to say from my role as an executive sponsor is this program equips people very well to actually, lead through transformational change. The program itself works on individuals' leadership style, and it gives them the knowledge that they need to actually create new models of care. And, in this world where we're doing integrated care, they're able to join all of the dots together to make those things happen. So as a sponsor, really, you're getting somebody who's going to grow in confidence and competence towards working with boards or being on a board. And as a result of that, you will grow capability to actually make the future happen. As we're seeing throughout England, we're moving towards integrated care systems, and the rate limiting factor could well be capacity and capability. So you're growing individuals that will lead this journey and take your organisations on this journey. So from my perspective, it was lovely to watch individuals grow, but in order to do that as a sponsor, you really need to make space for these individuals, and that can mean different things for different roles. So first of all, it's a good idea to have regular contact and to make sure that the work that they're doing, the action learning, i.e. taking things from the workplace and evidencing them as part of the programme, is aligned with what the organisation needs. Supporting the individuals through that learning journey and helping them grow as a leader as well. So taking that time, maybe once a month, to actually sit down with them, and also being there for ad hoc queries as well. So, as individuals, I call it hitting brick walls. Occasionally people, suddenly get to a point where they're stuck, or they don't know what to do next, or they want to talk something through because they've got some, different ways of dealing with things. And, just making that time for individuals, occasionally ad hoc when they need to talk, I think is really wise. Now, some organisations have given ring-fence time. In the case of, doctors and potentially nurses, it could be study leave. In the cases of CIOs and digital professionals, it may well be other flexibilities that can be given. But really, that's something as a sponsor you need to talk through with the individual about how they're going to manage their time. I have to stress that we do everything possible here to make sure that they're bringing the challenges they have in the workplace to the programme to work on. And so what we're not doing is duplicating, some academic exercise that is not related to their workplace. The aim here is to reduce the overhead on individuals, and we have a very high retention rate. I think one of the highest, if not the highest, at Imperial for an adult learning programme of its type. The reason is that pastoral support, and also the fact that we are really helping people in their day job while they learn. But part of your role is to help us with that pastoral support as well. And sometimes I have to make calls out to sponsors and say, one of the individuals is struggling or there's an issue. And so being willing to actually work with us to support those individuals, I think, is very important. Also, as a sponsor, I think it's important to work with individuals on what their career plans are and their career journey. Many of these individuals we have seen move from this programme and expedite the career journey. And I think it's worth recognising that we do have a vacuum actually of talent that we need to fill. And these individuals are moving towards these roles at a faster pace, potentially, than their counterparts. So it's always good to keep up that dialogue with the individual about their aspirations and how they can meet the organisation's needs. So overall, as a sponsor, it's really about making sure that your organisation can leverage this individual and the sort of growth as a leader that they that they're taking on this journey. It's also about making sure that the individual is seen and heard and supported. And as Sam said, we do an awful lot. We work with neurodiverse individuals. We work with individuals who have carer responsibilities. We go to quite extraordinary lengths of people bringing individuals they care for to residentials, people having additional support for childcare, all sorts of things that we've done to include individuals, and in the spirit of that sort of inclusiveness, to make sure we have a diverse cohort from every perspective, be it professional, be it neurodiverse, be it, responsibilities. We need to, gain your support in making this happen for individuals. It is just a year. A year does pass quickly. We're on to cohort 5 now. And this is very transformational for individuals. It catalyses leaders that are going on and up in the boardroom. And we are seeing, a number of these individuals in the boardroom leading on digital strategy and other things now, which is absolutely fantastic. So overall, I've really enjoyed being a sponsor. I've kept my phone on and WhatsApp on for the individuals that I sponsored through the programme, and I've really enjoyed watching them grow. But we do ask that you are an active participant in this journey, because your organisation will benefit from the talented individuals who are growing. And equally, I think in this world of the ICS emerging, you're going to get some people that are working in action learning sets with people around the country who are getting exposure to what is happening, to other individuals who are working in this space and are creating support networks and knowledge networks that will enable them and your organisations to be more successful. So really, that's my summary of what it means to be a sponsor. But I would encourage you to really engage with the programme, and I'm very pleased that there are so many curious individuals around this programme. It's been very nice to work with the sponsors I've worked with to date, and it's been beautiful to see some of the support mechanisms and put in place for participants to allow them to be successful. So back to you, Sam.
Thanks, Rachel. That's really helpful to get your thoughts on that. We'll take a pause in a second, and just for anyone who's joined us on the call, very welcome to take any questions regarding executive sponsors for anyone who's on the call. Just in case, while people are having a chance to think and perhaps type anything into the chat box that they want, I just wanted to ask your thoughts, Rachel. We've had a few recurring questions throughout the recent weeks for applying for cohort 5 about executive sponsors, and I wondered if I could just pick your brains on one or two things, because it's likely perhaps maybe people on the call today, or likewise anyone who listens back to this, may have similar questions. So we've had a recurring question, one which is around identifying perhaps a suitable executive sponsor. So we've got some information on the screen here, and likewise there's more information on our website. So individuals have asked, I guess, how can I find the most suitable or identify the most appropriate executive sponsor? So while the programme certainly doesn't specify executive sponsors to hold a particular title, a particular role, I just wondered whether you have any thoughts and perhaps guidance to anyone who's listening around how could they best find or identify an executive sponsor for themselves.
Absolutely, and some of these individuals have got very complex situations. So they're working in a clinical role, they're working in a digital role, they have many masters and mistresses, if you like, in terms of the people that look after them. And that's interesting to navigate. The reason is we need to find somebody that can actually support them in the digital space. So some people come and say, well, should I have my clinical director actually helping me with this programme and being my sponsor? And the question there is really, do they have an interest in digital? Are they working with you in the digital space? And quite often we find they're not. So I encourage people to go as high in the organisation as they can. And the reason is these people are on career journeys that are quite often being expedited. And the aim really is that they can work in or at board level. And so I do encourage them to try and find a senior leader. And quite often they may say, well, I'll go to my line manager, but sometimes it's their line manager's line manager that's more appropriate. And we will support them in having that dialogue with a senior member of the team about becoming the sponsor. But really, if you look at somebody senior in the organisation, they can unlock the strategic sort of ability for change to happen and support the impact individuals can have. And so for me, typically it's looking for somebody who is very switched on about digital change, digital transformation, data, those sorts of things. So it's looking for a senior lead, and do not be afraid to bypass your, courteously your line manager or whatever, we will support you in actually going for somebody at board level or at senior leadership if that's most appropriate. So for me, I think that the sort of summary is, find somebody that's passionate, find somebody that can help you, and find somebody that's definitely in the digital and data space. Don't look at just somebody who might be your direct line management in one of your roles, because that's what they do if they're not going to have the impact for the organisation. Really try and take an organisational ICS or sort of locality lens and say, who's going to help me have the impact here.
Thanks, Rachel. That's really helpful, and hopefully people on the call or listening back to this, hopefully that gives some reassurance as well around, I think it is the key bit there is obviously, the importance of being able to open doors and have that support mechanism for executive sponsors. But it's really helpful. Thank you, Rachel. I just had one more thing, if it's all right, just to ask you, and then I will stop and we'll take any questions from anyone who's joined us today. Just on a similar theme, really, of identifying executive sponsors, we've had recurring questions from individuals around if I identify an executive sponsor, either prior to commencing the programme or during their time on the programme, there is perhaps a likelihood that their executive sponsor may change, either because the individual themselves changes role, changes organisation, or likewise the executive sponsor moves on and changes role or organisation, and from a million other reasons as well that could cause that. I just wondered, again, just from your point of view, what support is available to individuals, or what advice you would give to individuals who perhaps think or preempting that on the horizon there could be a chance for their executive sponsor to change throughout their time on the programme.
Absolutely, and there are a couple of situations, one where the sponsor, say, moves on or changes role, and one where our participants while on the programme move on to new challenges because they've already gained the confidence to do that. So we do see it really quite frequently. And we do talk that through with individuals about how they reorientate themselves. Now, it may be really obvious who your new sponsor is going to be, if somebody moves on or if you change role, or it may be something that you need a little bit of facilitation to actually work through. We'll talk that through with you, and equally we'll send the materials to the new sponsor or proposed new sponsor, and actually point them at the likes of these materials as well to make sure they're orientated. But the last thing that we want is for people to feel disorientated by a sponsor moving to a new role or not, being able to be the sponsor anymore. And we don't want to hold back people's career journeys while they're on the programme, where they feel that they can't move because they're kind of locked into a sponsorship arrangement that works for them. We want them to be able to embrace new jobs. So we've been really clear here. We'll help you reorientate yourself, and people really successfully have moved jobs or found sponsors. We've had one person that's had to change sponsor twice because they moved role and then their sponsor moved role. So those sorts of things, we do everything again with the pastoral care to settle individuals and make sure that they are sort of bedded into the new arrangements. But this is quite expected in the world we're in at the moment. We have many changes in the environment, and the executive sponsor sort of baton, I think, could be passed quite nicely if we manage that in a sort of controlled way as well. We do everything possible as well with the assessments and the action learning to make sure that it's done in bite-sized chunks, so that if you move role during the programme, for instance, the organisation may change and you move into a different role, or you may get a promotion, then you can sort of do a reflective piece on the previous job, and then you can move forward into looking forward to strategy in the new job as part of the assessment. So we're making sure we're not precluding anybody from feeling that they can't progress their career journey while they're moving, and equally that they can't move because they're sponsors in one organisation or in one place. So really, overall, I think we've settled most people really well with their sponsors. Just ad hoc, I occasionally have to get involved with an organisation and just talk to them about supporting an individual, but that's very rare.
thanks, Rachel. That's really helpful to hear, and likewise for people on the call or listening back. Hopefully that just gives reassurance that, you know, it's not uncommon for executive sponsors to change for varieties of reasons, but I think the underlying message there is there is plenty of support available, whether it's individuals who are in the process of applying. Do get in touch with the Digital Academies team, or likewise as well with our colleagues at Imperial, and like equally participants who do go onto the programme. As Rachel said, there's a real strong support mechanisms available from our colleagues at Imperial to be able to support any changes. So I think the real underlying message there is that don't let potential changes to executive sponsors put you off applying or participating in this programme. It does happen, and there is support available to make sure that any changes happen smoothly, really, to help you throughout the programme. So thanks, Rachel. That's really helpful to hear. So at this point, I think we're going to end the formal sort of discussion around executive sponsors, and just, I guess, for anyone who's on the call at this point, whether there's any questions either in the chat, I'll just have a quick look, or likewise, if anyone wants to raise their hand regarding executive sponsors, then we're happy to take those. Happy to take those from now, really. I'll give everyone a couple of seconds just to, if people are typing or have want to pause for thought for a second. I guess apart from that, thank you to everyone who's joined us today. Appreciate you taking the time to join us. Hopefully you found this helpful to inform your thinking around executive sponsors. Apart from that, I guess we'll formally wrap things up here, and as I said, myself and Rachel will stay on the line for 5-10 minutes if anyone does want to stick around and ask any questions. So thank you very much, everyone. Appreciate your time, and thank you again, Rachel, for joining us today.
Thanks for inviting me.